Welcome to a presentation about Early Access, Iowa's System of General Supervision for IDEA Part C. Iowa's Early Access Integrated System of Early Intervention Services is Iowa's implementation of Part C of the Individuals with Disabilities Education Act. The Iowa Department of Education, in collaboration with the Iowa Department of Health and Human Services and Child Health Specialty Clinics, is responsible for implementing a system of general supervision to improve results and functional outcomes for children and families, and to ensure requirements of IDEA Part C are met. One of the components of the general supervision system is to use data to analyze performance across indicators reported in Iowa's State Performance Plan and Annual Performance Report. The State Performance Plan is a 6-year plan to establish improvement activities and meaningful, measurable targets on indicators to ensure Iowa's early access system is providing and sustaining quality early intervention services. Iowa reports the annual performance report and progress on each of those indicators in an annual performance report due each February to the U.S. Department of Education Office of Special Education Programs. The monitoring priorities are in the child find, early intervention in natural environments, effective transition from early access, and the State Systemic Improvement Plan for IDEA Part C. The Iowa Council for Early Access advises and assists the Iowa Department of Education, Iowa Department of Health and Human Services, and child health specialty clinics in the implementation of a statewide, comprehensive, coordinated, multidisciplinary, and interagency system of early intervention services. One of the Council's responsibilities is to advise the state in the performance of implementing the Individuals with Disabilities Education Act, referred to as the acronym IDEA Part C, or Early Intervention Services for Infants and Toddlers and Their Families. This may involve the following steps: ensure early access, implements IDEA Part C by reviewing data to recommend strategies. What do the data tell us? The Council reviews and analyzes the data to determine how early access is performing as a state and across each of the area education agencies, which are Iowa's early access grantees. Engage the public. Each of the council members represent families, services, or organizations involved directly or indirectly with early access services. What do constituents involved in services and supports for children birth to 3 and their families say about early access services? Improve early access. What are the areas of improvement, strengths, and opportunities to support early access services? How is early access enhancing the development of eligible children, minimizing the need for special education services when they turn 3, and enhancing the capacity of families to meet the unique needs of their children? The annual performance of the state and area education agencies are reported for each of the established indicators in the annual performance report, referred to as the acronym APR. Currently, there are 12 APR indicators to review progress or slippage based on annual targets. Indicators are areas of priority to determine the effectiveness of a state's implementation of IDEA Part C. The targets are established in the state performance plan as a result of baseline data and expected trajectory of improvement across the 6-year plan. The targets are measurable data points for each indicator. The data are collected in the Achieve system and analyzed based on the defined measurement parameters. The APR functions as a progress report and guides continuous improvement to ensure early intervention services are improving results and outcomes for children and families. While Iowa reports the indicators in the APR as in a numerical sequence, this presentation will take you through the indicators in a sequence in which families and children may experience early access. The involvement of early access begins when children are referred to early access at any time between birth to 3 years of age. These data are referred to and reviewed as a part of indicators C5 and C6, followed by an early access team completing evaluations and assessments to determine eligibility for services, represented in Indicator 7. And this may result in an individualized family service plan, referred to as the acronym IFSP, to provide family guided services for families and children eligible for early intervention services, referred to in Indicator C1 and C2. I want to introduce to you Grady. The story begins with Grady, the son of Shannon and Jake, and Caitlin's little brother. Just 18 hours after birth, Grady had a choking fit, which required oxygen, followed by 18 days in the neonatal intensive care unit. The first year of Grady's life, he had various medical procedures and missed the developmental milestones at his 9-month checkup. Grady's pediatrician told Shannon and Jake about early access, and the family contacted the AEA. Iowa's Child Find System, family members, healthcare providers, Iowa Department of Health and Human Services, and community members may refer children birth to 3 years of age to early access when there are worries, concerns, or questions about children's growth and development. Iowa established a comprehensive child find system so infants and toddlers and their families, such as Shannon and Jake, are connected as early as possible to a system of early intervention supports. The early access system involves a collaborative partnership with the Iowa Departments of Education, Health and Human Services, and Child Health Specialty Clinics, along with area education agencies, local organizations, and communities to identify, evaluate, and enhance the development of infants and toddlers and their families who are eligible for early access. The Council is responsible for assisting in intra-agency and interagency collaboration to ensure the system is coordinated with other major state and local programs and efforts to locate and identify young children potentially eligible for early access. The Council reviews various child find data representing infants and toddlers being referred to early access. These data are measured and reported in Indicator C5 for birth to 1-year-olds being referred, and C6 for birth to 3-year-olds being referred to early access. Iowa's criteria for eligibility for early intervention IDEA Part C services is a developmental delay of 25% or more in any one of the developmental areas listed here: cognitive, communication, physical, social emotional, or adaptive. Another eligibility criteria is if a child has a diagnosed condition known to cause later delays. Also, teams may use informed clinical opinion if the team experiences an evaluation and assessment that are either inappropriate or fails to determine eligibility in a valid and reliable way. Let's learn more about Grady and his family. Grady and his family participated in the early access evaluation and assessment process. Grady was eligible for early access due to developmental delays. After an infant or toddler and their family are referred to early access, a service coordinator will be assigned to provide the family with information about early access evaluation, assessments, and services. With parental consent, An early access team will meet with the family and child to complete a comprehensive evaluation and assessment and gather information from the family about their priorities, resources, and concerns. The child find process, which starts on the date of referral to early access, includes the initial evaluation to determine eligibility for services, child and family directed assessments, and an IFSP team develops an initial IFSP. The process must be completed within 45 calendar days from the date of the referral to be considered as timely. It is understandable if families are not available to meet with service providers within this time frame, which must be documented and achieved to be considered as an exception. These data are measured and reported in indicator C7 or 45-day timeline. The IFSP teams continue to gather information about families and children as part of early access services to ensure services meet the children and families' concerns and priorities. More about Grady. The IFSP team developed a plan based on Shannon and Jake's priorities and concerns for Grady's growth and development. The family's priorities were to support his abilities to move around and communicate his needs, while also involving his big sister, Caitlin, in their daily activities. Additionally, Shannon wanted to learn more about Grady's needs so she could confidently advocate on his behalf. The early access services written in the IFSP are to be provided as soon as possible after parents sign consent for the early access services. Iowa defines timely as providing each of the early access services within 30 calendar days of the signed consent. Therefore, each service provider must begin services within this timeframe to be in compliance with the requirements to provide services as soon as possible after parents' consent. It is understandable if families are not able to meet with service providers within this timeframe, which must be documented and achieved by the service provider to be considered as an exceptional family circumstance. These data are measured and reported in indicator C1. Additionally, early access services are provided in natural environments, which means those places and settings where children without developmental delays go throughout their day. The focus of service is to guide families in learning strategies to implement interventions during daily routines and activities. The early access service coordinators and service providers build families' capacities to meet the unique needs of their children. Therefore, services are primarily provided in families' homes or community settings such as childcare. These data are measured and reported in indicator C2. The vision of early access is for every infant and toddler with or likely to have a developmental delay and their families will be supported and included in their communities so they will be healthy and successful. The system of general supervision incorporates this vision as part of results based accountability to ensure early access services are enhancing the results and functional outcomes of infants, toddlers, and their families. The next series of APR indicators measure the benefit experienced as a result of early access services provided with children and families. The family outcomes and early childhood outcomes are connected and intertwined. A positive outcome experienced by families serve to promote children's development, and progress and outcomes achieved by the children benefit the family. Data are collected on family outcomes and early childhood outcomes to measure individual progress as well as state and regional progress. Family guided routines based intervention, or referred to as the acronym FGRBI, is an evidence based approach for providing early intervention services within children's and families' natural environments, consistent with IDEA Part C requirements. Iowa State Systemic Improvement Plan, referred to as the acronym SSIP or SIP for early access established FGRBI as the evidence based practice to promote building families' capacity to enhance their children's growth and development. Early access services focus on family or caregiver implemented interventions. The early access service providers facilitate coaching the family or caregiver to engage their children in learning as they participate in activities and everyday routines which are meaningful to the family, caregiver, and children. At the IFSP annual review, and when children exit early access, families receive an email request to complete an online family survey with 15 questions about what extent early access services help them to A. Know their rights in early access, B. Communicate their children's needs, and C. Support their children's learning and development. States are required to report the results of a family survey, which indicates the effectiveness of early intervention in helping families. These data are measured and reported in indicators C4 and C11 as a measurement of family engagement, competence, and confidence. The goal of early intervention is to enable young children with developmental delays to be active and successful participants during their early childhood years and in the future. States collect, analyze, and use data on 3 early childhood outcomes to measure child progress toward improved results and to improve the early access system and services. The 3 early childhood outcomes, referred to as the acronym ECHO, encompass functional skills and behaviors that are meaningful for a child's participation in everyday routines. They cut across developmental domains to represent the integrated nature of how children develop, learn, and thrive across settings and situations related to outcome 1, positive social emotional skills, which include social relationships. Outcome 2, acquisition and use of knowledge and skills, which includes problem solving, playing, and communicating using language. And outcome 3 is use of appropriate behaviors to meet their needs, which includes moving around, self help skills, and expressing their needs. Each IFSP describes children's present levels of development in the 3 ECHO areas on the initial IFSP and annual review. IFSP teams, including families, determine how a child's present levels of development and abilities compare with peers without delays by completing a decision making matrix. The team completes the final ECHO at the time a child exits early access to determine the progress from the time the child entered early access to the time the child exited early access. The ECHO descriptions are used to look at and report progress during the child's time in early access services. The skills children master at different ages are measured and described in the context of rates of growth. You will see in the graph the different growth rates or developmental trajectories represented by the color bands. The dotted line represents typical developing peers in each of the 3 graphs. The first graph shows an example of a child who had a rate of growth which narrowed the gap by improving the rate they were learning and developing new skills. The second graph is an example of a child who closed the gap. You can see this child entered services performing skills which were below what would be expected or comparable to their peers. And when they exited, they were performing skills comparable to children of the same age. The third graph shows a child who sustained levels of growth expected for their age. This child started services functioning at the same level as typically developing peers, and when they left or exited services, they had continued to learn and develop skills comparable to children of their same age. A summary of children's improvements and growth during the time they received early access is summarized into two summary statements. Summary Statement 1, made greater than expected growth, represents children who narrowed the gap or caught up to same age peers without delays. Summary Statement 2, at or above age expectations. Children in this category close the gap by catching up to the same age peers without delays, and those children that continue to maintain a rate of development comparable to children of the same age while participating in early access. These data are measured and reported in indicator C3. Again, as summary statement 1, children who narrowed the gap plus children who closed the gap. And summary statement 2 includes those same children who closed the gap in statement 1 plus children who maintained development compared to peers without delays. In each of the three ECHO areas, we report summary statement 1 and summary statement 2 for positive social emotional skills, acquisition and use of knowledge and skills, and use of appropriate behaviors to meet needs. The early access service coordinators and service providers discuss the transition from early access with families to support their understanding of early intervention services ending for children at the age of 3. The transition from early access requires timely and effective coordination and collaboration. Service coordinators and other team members support a smooth and successful transition for families and children by providing details about what to expect as they prepare for transition. Let's talk about, again, Grady. As Shannon and Jake approached the transition from early access, Grady was diagnosed with a rare genetic condition when he was 2.5 years old, which may affect his cognitive and communication skills. Prior to his diagnosis, Grady met with more than 40 different physicians, therapists, and medical professionals. He was hospitalized twice, sedated on 3 separate occasions for medical procedures, and provided blood samples for 5 rounds of genetic testing. While Shannon and Jake were apprehensive about exiting early access, the IFSP team developed and implemented a transition plan which included steps to prepare their family and Grady for a change in services. The team discussed Grady's developmental abilities and progress and agreed upon involving the special education team in the transition planning process. Grady's transitioned from early access to special education a week before he turned 3. He began attending the district's preschool on an individualized education program, or referred to as the acronym IEP, to receive special education services and supports. So, transition. Transition means families and children will exit early access services and may start a new preschool program or services in the community, continue attending a program, or begin receiving special education services. The transition planning process ensures a smooth transition for children and families so they have timely access to appropriate services when they exit Part C. Three requirements for transition includes the following actions, and they must occur at least 90 days or more prior to the toddler's 3rd birthday. 1. Developing steps and services to ensure that families and children are prepared for exiting early access and possibly entering a new program or setting. Number 2, invite an area education agency special education facilitator For those children that are potentially eligible for special education or referred to as Part B 619 to be part of the transition planning process. Or, number three, conducting a transition meeting at least 90 days prior to the toddler's third birthday for those children that we need to include special education facilitator for children that are transitioning or potentially eligible for special education. These data are measured and reported in indicator C7 as timely transition and timely transition planning with steps and services, timely notification, and C, timely transition planning meeting with special education to determine if transition planning will be from early access to special education. Dispute resolution and procedural safeguards. Parents have rights known as procedural safeguards, which apply to every aspect of the early intervention process, such as the initial evaluation, access to records, and individualized family service plan, team participation, and parental consent. The procedural safeguards for parents' rights for children birth to 3 helps families understand the rights under IDEA Part C. Data on the use of mediation to resolve disagreements that may occur is measured and reported in Indicator C9 and C10. Iowa's System of General Supervision notifies the Early Access Grantee, which is the AEA, of individual and systemic noncompliance of IDEA Part C requirements. The Early Access Grantee is responsible for correcting all findings of noncompliance and ensuring that early access service coordinators and service providers understand the requirements of IDEA Part C. Once corrections are completed, which must occur within 365 days of the finding, the early access state staff at the Department of Education review the data to ensure corrections have been made and IDEA Part C requirements are being implemented by the AEA and early access staff. These data are reported in Indicator C12. For more information about Iowa's SPP and APR, you may visit the Iowa Department of Education's webpage. Under Special Education Reporting, SPP APR Reporting, specifically Early Intervention, at this website on the slide. The next series of slides provide you with each of the indicators described above and the measurement used for reporting in a sequential numerical way. If you want to learn more about early access, use the link provided on this slide to learn and hear about Kaya's story. We want to thank you for participating in this presentation. The presentation was presented by and prepared by the Early Access State Team. Thank you, and the end.